This is the most important assessment, because if a child is not able to walk or he walk, then we assess multiple things which already we will discuss as per the sequence. One is the contractures. We have to see whether the contracture is dynamic or fixed. Dynamic contractures are usually easy to manage, and the fixed contractures we have to further assess why it is fixity, maybe a structural changes, maybe muscle contracture are fixed. Then we also assess the range of motion, power of the muscle either on the one joint or other joint, as well as we generally examine our patients. Then here, these are the certain types. Then as per the age, usually these children may become sometime a worsening condition. This cerebral palsy is basically a static disorder, but sometimes you find that they develop, initially they were standing very right, but at the 13, 18 years age, they started having the crutches. It means this is not because of the progression, but it is because of the age growth spurt period and the weight he has gained. And you have to take care of this. You have to advise accordingly. Your child is getting bulky, you must have, he was an Equinus, now he is developing. It is because of his weight and the growth is